Well, I'm looking forward to that. Thank you very much, Fatih. Let's introduce our first guest. To get, as they say, the introduction. Here comes. Let's welcome the Chief Executive Officer of Ambulance Victoria. I'm talking about Associate Professor Tony Walker. Tony, for those of you that don't know, registered paramedic with over 30 years' experience. He's worked in a range of senior clinical, operational, and leadership roles within the ambulance sector over that time. And over the past 6 years alone, he's led quite significant transformation at Ambulance Victoria, with the whole mission statement to improve the health and well-being of the workforce and the rest that they provide to the broader community. Worthy goals and worthy pursuits. Tony Akullo of the Australian College of Paramedicine and a board director of the Emergency Services Foundation and the Australasian Council of Ambulance Authorities. And he doesn't stop there. He's also put his hand up to be on the Prostate Cancer Foundation of Australia. Tony Walker, welcome and thank you for joining us.
Good evening, George.
Welcome,
Good evening, Fatih. How are you?
Good, thank
Pretty
you. How
good.
are you?
Good to see you both. Thanks for having me.
Likewise. Tony, if I knew I wouldn't go off cam, I'd actually stand up and salute you and your team. So just I'm sending all my love and respect to you and your crew. And I know that we've had a strong relationship with Ambulance Victoria. I'm speaking about Australian Cultural Society, of course. So that's a relationship that we definitely treasure. So we're really happy to have you on the program tonight. But I wanted to ask you, as the head, and also I want to mention that Ambulance Victoria has gone through some great transformation, and that's a lot of that is due to the leadership of yourself and also Ken Lee, for example. But that's not to discount the contribution of every single staff and member of your team. But I wanted to ask you, as the head of a large emergency service, how have you been doing at the moment?
Oh, I've been doing really well. It's been an interesting year, I've got to say. I mean, we've come off the back of bushfires, so I planned to have some time off at Christmas. That changed pretty quickly. I've come into a very busy few months with the bushfires, and then we've literally come straight into COVID. So it's been surreal, I've got to say, and I can't thank my workforce enough. They've just stepped up and kept the term pivot's the term we use a lot in our organisation at the moment. They've just shifted and changed to adapt to an environment that has just kept moving and moving and moving. And but I'm doing well. I'm supported by a great team. I've got a great family, and I'm learning, like all Victorians and around Australians, to adapt to this new norm that I'm in at the moment.
And Tony, how are you mentioned the staff's coping. Tell us about the front line, those who've done just an incredible job. What are some of the challenges that they're currently facing daily?
George, their world has changed dramatically. So they are coming to work every day and putting themselves out into a community where they have this understandable fear that they may contract a disease that can be lethal. And so that plays on their minds, and it's certainly we're providing a lot of support to help them around their mental health and wellbeing in that space, because it's a genuine issue. Their day consists of attending close to collectively around 200 potential COVID patients every day. Now, not all of those are clearly infected, but they meet the symptoms of it. So they're dressing up in hot overalls and hot gowns, masks. They are having to go in and adapt their care to patients who are equally anxious about what's going on. They're then transporting our patients to hospital, where we're finding that they're then having to hand over into a health service that is also under significant pressure and has different ways of accepting patients now in the new COVID world. So I've been blown away by how great they've achieved, what they've achieved, and how great they've been. But it's taking a toll. There's no question. They're in fact, often we describe a bit of what we call anticipatory anxiety right now. We've pivoted the organisation. They're ready to go for a war that we hope never comes. And there are little skirmishes every day, if you like, in the way we attend. But when we look overseas to what's happened in the UK and the United States, I'm so grateful to say to live in Victoria and Australia at the moment. It's what our leaders have done to ensure that we're as prepared as we can be, and have avoided to date some of the issues overseas has been phenomenal.
You've been morphing the protocols. Have they been changing?
They have. We've had to think differently and work with our medical directors and other health professionals to think differently about the types of treatments we provide to people with asthma. We've had to modify our asthma treatment, had to modify how we deal with cardiac arrest, for example, with a focus of ensuring our paramedics stay safe, but at the same time giving the best care we can to people who call us. We've ramped up significantly our secondary triage area. We have paramedics and nurses who are taking calls and providing advice to avoid ambulance care. And something I've got to say I never thought I would have seen 6 months ago is that I've had a situation where the community aren't calling us for some cases. So particularly older people in the community are scared of calling an ambulance, going to hospital where they may fear they may be exposed to COVID-19. And that's led to about 200 or 300 cases a day dropping down of people who would normally call us. Now, some of those probably didn't need to, and that's good. They're finding different ways to care for themselves, but there are others I really worry about, and we've been doing a lot of work to try and encourage people to make sure they're calling us when they need us.
So Tony, during this time where there's heightened anxiety and, as you said, fear, where people are choosing not to call Ambulance Victoria, what is Ambulance Victoria doing to bring people together during this time of social distancing?
Well, we're playing a big role in the use of social media. So we both internally and externally. So we've taken the view that we have an important role to play in the community to help connect the community. So to tell the good stories of things that are going on, to message to the community the important things they can do to keep them safe and us safe. And internally, we've done a lot of work in communicating differently. I can't connect with my workforce as I used to. So we're using an internal Facebook site. So even tonight, we've had online sessions with our staff to engage with us and talk about key issues. We're polling and doing work with them online to get hear the things they might need to hear about. We've brought specialists, not dissimilar to what you're doing tonight, bringing in specialist speakers for our staff who can give them assurance around COVID-19 infection control, the things they can do to keep themselves safe, and celebrating the important things. I'm using a lot more videos. We had a great video, in fact, this last week on Ramadan that's included a number of our staff of Islamic faith. It's been brilliant, and they've told you can ask anything you can ask. Pretty much, they're similar to the you can ask that, similar to the ABC show, where they've been able to answer questions that people would often ask them at Ramadan in a way that they would often get the opportunity to do at the dinners that we can't unfortunately have this year.
Tony Walker is our guest on Ramadan Conversations. Tony, you'd have a lot of collegiate friends and also professionals around the world. Are you liaising with them at this time to see how they're taking on board the challenges that face us day in, day out?
We certainly are, George. We are a big connected family in some ways in the emergency services and health sector, and so we've reached out to each other to learn from what we're doing. So we've for example, Scotland and Wales are two ambulance services that are very similar to our own, and so we've looked at some of the work they've been doing and introduced that into some of our scenario planning for the worst case scenarios that we hope never come, but we've got to be ready for. We've spoken to health colleagues in the United States, and in fact, just last week attended a video conference with the head of emergency services over there, where he was taking us through the hospital that he's responsible for, and it was just surreal to be in the middle of New York City at this time to see what's going on and to be part of it. So we're learning a lot from each other, sharing a lot of information, and making sure that we're preparing ourselves on the basis of what we're seeing in places that have really had significant COVID-19 cases, so that we're well prepared. As I said, we hope, we plan for the worst and hope for the best, and so we're learning a lot from overseas to make sure we're prepared if we ever saw the sorts of disease numbers that they have. Now, I don't expect we will, but we can never be complacent here because we saw how quickly it can get away from us in the United States and the UK.
Yeah. Another for you, Fatih.
Oh, sorry. Yeah. So, sorry. The internet broke out for a second there. So, Tony, the Ambulance Victoria is a community service, and Ramadan is a community celebration. What have you seen in the community that gives you hope during this time?
And it's an interesting question. If I look back to, say, 8 to 10, 12 weeks ago, I was a bit worried about our community. I was worried by what I was seeing in the hoarding of toilet paper and some of the reactions to people. I think, like many of us, we're all sitting there going, where am I going to get toilet paper from? But it was interesting how society and people reacted. And then they shifted. Then I saw the caring come back into what I've seen, and it's expanded beyond what it was prior to COVID. I'm seeing people taking interest in their neighbours now in a different way than they ever did before. Shopping for them, talking to them. We've been forced to stop for a bit, and in some ways enjoy time with families that actually, getting to know each other differently. Our workforce, it's interesting. My sick leave is right down at the moment. I was asking some questions of late to understand what that might be. And there's that real sense of camaraderie and wanting to be there to support colleagues at a time like this. And a few of my colleagues said it's actually I can legitimately leave the home. So it's interesting people are able to legitimately leave their house. So that caring is coming through loud and clear. And just this week, Mentone Grammar sent us 300 messages that their kids had written to send off to our paramedics to thank them for all that they've done. Paramedics are getting offered coffees. I'm seeing, and they're offered. For example, just this week we got offered some gloves that we can't use, but we've donated to the local food preparation area at one of the hospitals. So there's this sense of wanting to care and give back that I've got to say it's always been part of the Australian spirit, but I think it's been lost in some of the commercialism and some of the daily drives. So no, it's fantastic.
Fantastic.
You speak of fantastic collegiate work. I saw a story only the other day about a group of Australian nurses overseas at the moment in New York doing what they can to help the health system there, which has been absolutely inundated. The numbers coming out of New York alone have been horrendous. Can you think one of the biggest cities in the world, one of the richest countries in the world, and here we are suffering a pandemic, and they are seriously struggling. That's extraordinary.
It's incredible, George. I look at what's occurring over there, and the impact it's had on all the health services, the community. We've experienced things here, obviously, in a way we've had to think differently about what we all do. But compared to what we've seen overseas, we made some very early decisions here in this country that have clearly proven themselves to be the right decisions. And I think we should be grateful to live in a place where our leaders have felt the confidence to do and make hard decisions that would not have been easy, I'm sure. And we're seeing today the benefits of that. In other places, they're now trying to catch up, and it's obviously it's so difficult to do because of the volume of cases they've now got in the community.
Tony Walker, thank you for joining us and giving us a sense of what's been happening behind the scenes, especially with your organisation, Ambulance Victoria. And again, thank you for being a part of Conversations.
Thank you.
Thank you so much. It's been lovely talking to you both. Thank you.